My name is Kenan Stern. I'm a pediatric cardiologist at the Mount Sinai Gravis Children's Heart Center in New York City. Heart murmur is a noise caused by the heart that your doctor or pediatrician may hear when they listen to your child's heart with a stethoscope. Heart murmurs are fairly common, and many children will have a heart murmur heard at some point in their childhood. Heart murmurs are caused by various things. Most of the time, it's not caused by any problem or issue with the heart. There's something called a benign or innocent murmur, which is the sound of a normal heart beating or the sound of blood flowing through a normal heart. Sometimes, however, a heart murmur is caused by a heart condition. Sometimes a hole in the heart, a narrow valve, or a leaky valve can cause a heart murmur. Your pediatrician may hear a heart murmur when they listen to your child. If they're concerned about how the heart murmur sounds or symptoms that your child may be having, they can refer you to a pediatric cardiologist. A pediatric cardiologist will evaluate your child and may perform an examination called an echocardiogram, which is a non-invasive ultrasound device that takes pictures of your child's heart. And this can diagnose if there is an issue with your child's heart causing the murmur. At the Mount Sinai Children's Heart Center, we will thoroughly evaluate your child and their heart murmur and perform any necessary diagnostic imaging, including echocardiography. The cardiologist here will thoroughly explain your child's diagnosis and what treatment, if any, is needed for their heart murmur.